Hi, welcome to Bodyworks MD Shoulder Main Rehab Program. Let's begin with a 5-minute warm-up. The blue team leader is Melissa. She is a professional indoor cycling instructor. The white team leader is Paul, who is a licensed physical therapist. The red program leader is Brittany, who is a group fitness instructor and a personal trainer. Let's begin our warm-up with 1 minute of side-to-side pendulums. For the blue program, again, we're going to use a warm, moist towel or an electric heating pad. If you don't have any of those things available, you can actually take a shower and let the warm water run on that shoulder. For the white and red programs, again, we're doing some pendulum exercises. We're trying to use our body weight to swing our arm into position. The red program can actually use a hand weight and more so actively move our arm from side to side. How are we all feeling? All right. We just keep those arms nice and gentle, using gravity to allow it to swing. Everybody looks great while they're doing this. How's your arm, Melissa? Excellent. All right. Okay, everybody, let's move on to some circular pendulums. We're going to do this again for another minute. The main program is designed specifically for the injured arm. If you'd like to strengthen your opposite shoulder, we recommend that you do so after completing this tape. Okay, everybody, keep it going. What's helpful in doing these exercises is if you have a mirror where you can check your technique and look at yourself. It's very important to make sure that your technique is correct. How are you all feeling? Again, if at any time you experience any discomfort, please stop what you're doing. You might have to consult your physician if it persists. Okay, everybody, for the next minute, we're going to do front to back pendulums. As you go through this program, if your current level of therapy is no longer a challenge and your pain is actually getting better, you can move on to the next program. But please review those techniques. Remember, it takes time for your shoulder to respond to these exercises. Please be patient. Again, if there's any problem, you'll stop the exercise, review the technique, and maybe go back to an easier level. If pain does persist, you may want to consult with your physician. For any exercise or rehab program, the concept of no pain, no gain is just not acceptable. How are we all doing, everybody? Well. All right, everybody looks good. Nice and easy with those arms. How's our shoulder feeling there, Melissa? All right, fantastic. For the last minute, we're going to change over to a little bit more active exercises. And actually, for the blue program, Melissa, you can start to do some pendulum exercises. Let's start out the other programs doing some saw-type motion for the next 30 seconds, and then we're going to move on to some whirly birds for the last little bit. How does that feel? Looks good, looks good. How you feeling there, Melissa? Again, for the pendulums and the blue program, let's use our body to actually move that arm. And we can do clockwise pendulums, and then we can go counterclockwise. How's that feel?
Feels great.
Okay. Looking good, Paul. Looking good. Okay, for the red and white, let's move on to some whirly birds. Melissa, you're going to keep doing those pendulums as you are. Now again, don't have to lift your arms very high. Keep them at shoulder level. We can go forward rotation and we can go backwards rotation. It's important for any exercise program as we go through a warm-up and the main rehab program that will also follow a cool-down period. This will involve some gentle stretching as well as applying some ice to that shoulder. Remember, icing should last anywhere from 10 to 15 minutes, can be repeated every 1 to 2 hours, and please make sure when you place ice over your shoulder that you have a protective layer covering it. We don't want you to burn your skin. How's everybody doing? Looks good, everybody. Keep it going. Paul, maybe your arm's a little bit higher. Make sure you feel okay doing that. Looks good, Brittany. Melissa, we're still doing okay? All right. Okay, everybody. Now that we're done with our warm-up period, let's advance to our stretching exercise program. Okay, let's start the series of stretching exercises. Okay, everybody, let's get into position. We have Melissa on a mat, Paul's going to be on the table, and Brittany's going to be facing the wall. Okay, everybody, let's start the first set of 15 seconds. Everybody lift up and push in. Nice and easy, Melissa. Bring that arm back. Perfect. You're going to hold this for a count of 15. How does that feel? Okay, don't push too hard past these stretches, but you should feel a nice little stretch. Okay, let's bring that down. Relax, everybody. Okay, let's bring it back up. Come on. All right, Brittany, just kind of push in with your whole body and you should feel a stretch up in the front of the shoulder. You feel that? Okay. Everybody looks great in this. Okay, a few more seconds. All right, let's bring it back up. Okay, this is our last stretching for this exercise, and let's get back down there. Come on now. How you doing, Paul?
Doing good.
All right, again, you can use a chair if you need to, if it's more comfortable, but you're trying to push that shoulder down and feel the stretch along the front of the shoulder. You feel that? Okay, great. All right, everybody, let's relax. A fantastic job with our first stretch. The next exercise is external rotation stretch. Okay, everybody, let's get into position. Okay, let's begin. All right, Brittany, try and just rotate that body outwards. Again, we're gonna feel a nice stretch up and through the front of the shoulder. You feel that? Good. All right, Melissa, again, we're gonna take this, our good hand, and rotate outwards. Meet some resistance, don't really push past it. Okay, bring it back to the center. Okay, let's go to the second, and let's begin again. All right, Paul, you doing okay?
Oh, yeah.
Trying to push that shoulder down. You're feeling it up in the front there.
Absolutely.
Keep that arm at 90 degrees. That looks fantastic. How you feeling there, Melissa? You okay? Good. Again, you can try and push gently outward, but don't push too hard. All right. Okay, let's relax on that one. All right, here's our last stretch, okay? Let's get into position and let's rotate, all right? Nice, easy stretch. And again, remember, if you have any discomfort with these exercises, please return to the exercise technique section and review that. Again, if it persists, you may want to stop the exercise and consult your physician. Okay, everybody, great job with that second stretch. The next stretching exercise is for internal rotation. So let's get into position and start. Okay, everybody, let's go and let's begin. All right, Melissa, just remember, when you're doing this stretch, get to a point that you feel some resistance and then try and push your shoulder back down. If this hurts, again, remember you can relax that hand and bring it lower down, okay? Fantastic. All right, let's relax, everybody. All right, the second time through this exercise, let's go. All right, Paul, you're gonna bring that shoulder across, trying to squeeze that elbow towards the opposite shoulder. All right, you should feel that stretch in the back. You feel that? How are we feeling, Brittany? All right, fantastic. Okay, guys, let's relax. All right, this is our last stretch, so let's make it a good one. All right, let's begin. Again, just let's be comfortable in this. Try and bring the hand up as high as possible, but don't kill yourself, okay? All right. You guys look great at what you're doing. Let's just keep this position and hold it a few more seconds. Great job on that stretch. The last stretching exercise is for shoulder abduction. So let's get started, okay? Let's get into position and let's begin the stretch, all right? How's that feeling there, Melissa? Okay? Again, you can use that arm to kind of push that arm upwards. You're gonna hold it, feel a nice stretch in there, correct? All right, everybody looks great doing this. A few more seconds. Okay, let's relax. Take it nice and easy. Take a big deep breath, and let's start again, all right? So again, Brittany, what you want to do is you just use your body to kind of lean into that wall, and you should feel a nice stretch in the under aspect of the arm. Feels good? All right. Hold that position. Another 5 seconds. Looks fantastic. Okay, everybody, let's relax. This is our last stretch for this shoulder exercise. Okay, let's begin. All right, Paul, and again, remember, if you're more comfortable in a chair, you can use a sliding chair to kind of move your body away and feel that stretch on the under surface. Okay, everybody doing all right? No problems. All right, we're almost done. Okay, everybody, let's relax. The next set of exercises are going to be the strengthening exercises. The first strengthening exercise is for forward flexion. We're going to do 6 sets of 5 reps each. Okay, everybody, let's get into position and let's begin. 1, 2, 3, 4, 5. Okay, let's relax. Again, remember, Melissa, what you're trying to do is to push that arm forward and resist that motion, okay? All right, let's do our second set. Here we go, let's begin. And again, Paul, if you have any discomfort with this, you can lower that arm down. Don't have to go up all the way. You can bring it to 90 degrees and bring it back down. Okay, and this is your last rep here. Okay, let's stop. All right, take a big deep breath. Okay, everybody, let's do our third set. Let's go. Here we go. How's that feeling, Brittany? All right, any problems? Okay, good. Looks good. This is 4. And here's your last one. Okay, let's relax. All right, everybody, we're all doing okay. Yes? Fantastic. Let's try for our next set. Here we go. 2, 3, that's it, keep it going. 4, last one. Okay, let's relax, everybody, and take a little bit of a deep breath. Try and relax, think about your shoulder, think about your form. Want to keep those shoulders nice and level. Don't want to hunch the shoulder up at all. Okay, let's go to our next one. We've got 2 more to go. Let's begin. That's 1. That's 2. Nice and smooth. There we go with 3. All right, 1 more. Keep it going. All right, let's take a break. Take a big deep breath. Here's our last one. All right, let's begin. That's 1. That's 2. You look fantastic there, Brittany. Just keep that arm nice and back. That's 4. And here's the last one. Bring it up. Okay, everybody, relax. Great job on the first strengthening exercise. The next strengthening exercise is for external rotation. Okay, everybody, let's get set and begin. Here we go. 1, 2, 3. That's a great job. 4. This is all meant for the rotator cuff. 5. Fantastic. Let's take a break here. Okay, take a big deep breath. Everybody's okay. All right, let's start our next one. Here we go. Ready? 1. Bring it up. 2. This is really a functional exercise for you, Brittany. It's really concentrating on a bunch of muscles as you pull that arm up. What we could describe really as a functional exercise. Okay, so let's take a break. Here we go with our third set. How are we doing, Melissa? All right, fantastic. All right, here we go. Let's begin. That's 1. That's 2. And again, you're trying to just resist that rotation of the arm That's 4. We got 1 more to go here. All right, let's take a break. Everybody all right? No problems, correct? All right, let's do our 3rd set. Here we go. Let's start it up. Let's go. 1, 2, 3, 4, and 5. All right, great job. You've got 2 more sets of this. All right, take a big deep breath. If that band is not correct for you, Brittany, again, you can go, this is one of the lighter bands, but we can go to a heavier band if it feels like it's too easy. Okay? All right, here we go. Let's begin. That's 1. Great job, everybody. That's 2. Good job, Paul. That's 3. And again, Paul, if you'd like, you can use a heavier weight or a lighter weight. Okay. Last one, here we go. Perfect. All right, we've got 1 more set of this, and then we'll be done with this exercise. Okay, here we go, guys. Let's go. Let's begin. That's the first one. Looks great. That's the second. Okay, nice and easy. That's the third. Here's the fourth. And this is the last one. Make it good. Fantastic. Okay, that's a great set of strengthening exercises. The next strengthening exercise is for internal rotation. So let's get into position and begin. Again, we're gonna do 6 sets of 5 repetitions. All right, let's begin. Good job. Just keep that arm nice and straight up as your anchor. Okay, got last one coming up. Okay, fantastic. Let's take a break. How'd everybody do with that one, okay? Any problems? All right, let's go to our second set of this. All right, good arm up there. There you go, Brittany. And let's bring their arms down. Let's go, everybody. That's 1. That's 2. Great job. Let's keep going. That's 4. And here's our last one. All right, let's relax, everybody. All right, we're still doing good. No problems. All right, let's do our 3rd set. Here we go. All right, let's begin. Here we go with 2. We're on our 3rd. We're on our 4th. Last one. Here we go. All right, let's take a break. Take a big deep breath. Everybody shoulder okay? No pain. Again, remember, we can adjust the weight of the band or the weight of the hand weight. All right, here we go. This is our 3rd set. Let's go. Here we go. That's 1. That's 2. Good job, everybody. Great job. That's 3. That's 4. All right, let's take a break. All right, we got 2 more to go. Here, let's begin. Ready? Let's go. Fantastic. All right, this is our 3rd. Paul, you're working the inner aspect of that shoulder. All right, it's for the subscap and your pec minor. It helps the front portion of the shoulder. All right, and that's our last one. All right, we've got 1 more set. Here we go. Let's begin. That's 1. That's 2. Everybody looks good here. There we go with 3. And 4. And last one. Here we go. Good job, everybody. That's a great set of internal rotation type strengthening exercises. The next shoulder strengthening exercise is for abduction. So let's get into position. The red program is going to do a little bit more of a functional exercise for this one. Okay, everybody, we're going to do 6 sets, 5 repetitions. So let's go. Good job, everybody. How you feeling there, Melissa? All right? We're working our deltoid out here, which is kind of one of the major movers of our arm and very important in shoulder rehab. All right, here we go. Our second set. Let's begin, everybody. And again, for Brittany, this is really a functional exercise. We're moving our whole shoulder with that range of motion. That looks fantastic. All right. Great job. All right, everybody. Perfect. Let's begin again. Here we go. You guys should not have any discomfort with this. If you do, take it a little bit easier, maybe not as high, Paul. All right, looks good. All right, everybody, here's our next set. Let's go. Let's begin. All right, looks perfect. Really looks good. No pain, correct? All right, here we go. Hold that arm, don't let it move. All right, good job. Here we go, we've got 2 more to go. Let's begin. Nice and smooth, Brittany. Keep that elbow nice and straight as you pull it along. Pretty much like playing tennis as you pull that arm across. It's a great functional exercise. All right, looks good. Okay, we've got 1 more set, and let's take a deep breath, and let's make this a good one. Okay, let's start, everybody. How's that arm feeling? All right, good job, good job. All right, that's fantastic. That was a great set for our shoulder strengthening. The last strengthening exercise is for extension, for the back portion of our shoulder. Where again, we're gonna do 6 sets, 5 repetitions. Okay, everybody, let's get into position. Okay, let's begin. What's really important about this is anytime we injure our shoulder is that the scapula, which is one of our main stabilizers, really becomes dysfunctional. And these types of exercises will really help this. All right, good first one. All right, let's get back into position and let's try that again. All right, Melissa, again, you want to hold that arm. You're working on the back side of the shoulder. You should feel, some resistance in the back here. Feels okay? Okay, fantastic. You guys are doing a great job. That's it. All right, let's go. We've got 4 more to go. Let's begin. Paul, when you're doing this, again, you got to really feel as if you're pulling your shoulder blades back together. Okay, that feels all right? All right, good job, everybody. All right, let's try that again. Let's begin. How's that feeling, Brittany? Okay, good job here. Good job here, guys. All right, that's it. Again, if you want to change the weight, you can adjust the resistance band to something a little bit more difficult or even pick up a heavier weight. Okay, let's begin. Melissa, if you need to, you can also use a wall instead of using your hand, but it's pretty easy to do this. Okay, that's great. All right, here we go. Let's start again. This is your last one. Let's begin. Try and keep your back nice and straight. Use that other hand for some support there for that leg. Okay, that was a great job on our last set of strengthening exercises. Now that you've completed the program for your injured or painful shoulder, please go back and repeat this or any of the other programs for the uninjured side. As with any exercise or rehab program, once you've completed this, let's get into a cool down phase. Again, that will be some gentle light stretching of both of your shoulders, and then please place an ice pack on your shoulder. Please put something protective like a layer of cloth between the ice pack and your shoulder. We don't want you to burn your skin. Again, the ice pack should remain for approximately 10 to 15 minutes, and you can repeat this every 1 to 2 hours. Using this program 3 to 4 times a week will help increase your strength and improve your flexibility. I know this will get you back on track. Please be patient with the video because it takes some time for your shoulder to respond to these exercises. I hope to see you in the next few days. You did a great job today.